It is Tuesday morning here on CB24 Breakfast, and as we do almost every Tuesday morning, we join Doctor Isaac Bogoch, infectious diseases specialist at Toronto General Hospital, to sort of talk a little bit about public health and infectious diseases. Dr. Bogoch, good to see you. I know your kids have got backpacks ready to go to school downstairs there. So let's talk, though, about back to school, because it's been an interesting summer. We had kind of a rise in COVID cases, perhaps more cases than we'd seen in past years. We also saw Mpox kind of popping up. So what should parents, teachers, students all be keeping in mind as another school year is getting underway?
You know, it's always hard to predict what's going to happen in an upcoming year. But I think if we take a step back and look at the 30,000-foot view, it's probably going to resemble last year. It's probably going to be very similar to last year. We're going to see influenza. We're going to see COVID-19. We're going to see RSV. We're going to see a lot of these infections predictably rise in the fall and winter season. We know that many of these have vaccines available for them. Mpox, I think, obviously we saw a rise in cases here in Toronto and elsewhere in Canada. But again, with love and respect and no moralization and no stigmatization, that was in a very narrow cohort of individuals. That was in the men who have sex with men community, and there's very tailored public health approaches and responses to that. So I think if we're trying to guess what this school year is going to look like, it's probably going to look like last school year.
Okay, all right, and I think that's a lot better than the last couple of school years prior to that, of course, when we were in the thick of the pandemic, no doubt about that. One other topic we've also brought up several times and even asked you about as well, of course, is whooping cough. Is that something could potentially be bad? What are the tips there to try and avoid that? Because that was something, I mean, yet again, a disease we hadn't talked about for years and years, but we're seeing it.
Yeah, really frustrating to have these conversations because these are vaccine preventable illnesses. And the key with whooping cough is, yes, there's more of it now in Canada than there has been in prior years. What's driving that? Probably many factors, including a variation in and pattern in disease, where there's a typical rise every 5 to 6 years of this infection. But I don't think we can ignore vaccination as well. Some people choosing not to be vaccinated when given the opportunity versus some people missed vaccinations throughout the toughest times of the pandemic and haven't caught up, versus barriers to vaccination, meaning some people might want to be vaccinated and might choose to be vaccinated, but there's challenges in accessing healthcare and public health. So I think all of that has to be considered. But the take-home point for me is this is, the vaccine, of course, isn't perfect, but it does a good job. And check your yellow cards, make sure you're up to date on your vaccines. And of course, not just with whooping cough, but with measles and other vaccine preventable illnesses, there's a well-trodden path of routine childhood immunizations. And we just have to make sure that we're up to date on those.
Dr. Bogoch, I'm always curious about, when you're contagious, because the whooping cough in particular, they also describe it as the 100-day cough. Coughing clearly being a symptom, and you talk about when kids have viruses, they're symptomatic while they're showing symptoms. When you've got a 100-day cough, does that mean you're kind of potentially contagious for 100 days in this case?
Nick, that is such a good question. And the answer is you are not contagious for the 100 days. You'll have terrible symptoms and you can cough for a long time. And sometimes that cough can be so severe that kids even can break a rib or have a blood vessel burst in their eye. Like, it is a very severe cough and it can be prolonged, but you're only really contagious for the first few weeks of this cough, maybe even a little bit shorter. So yeah, thank you for bringing that up. The symptoms will persist, but the transmission is only at the beginning of that.
Okay, yeah, I thought that was important to discuss, so I'm glad to get the answer there. Of course, and you also, in your sort of second last answer, we're talking about vaccines and proper timing, the yellow card, that kind of thing. But if you're maybe beyond that, or, we're looking at, getting vaccinations, is there a time, sort of an effective time for kids to get the maximum kind of effectiveness out of booster vaccines through the school year? Or is it just when you're scheduled, when your time's ready, get those needles in your arm?
I think the best thing is to stick to the schedule, right? Like, we know the influenza vaccines are going to come out sometime in late October, early November. It's a great idea to get a flu shot. COVID vaccines are going to come out probably at around the same time. The interesting thing with COVID is look at the wording, right? The National Advisory Committee on Immunizations has already released their suggestions for COVID-19, right? They said there's groups of people who should get the vaccine and other groups of people who may get the vaccine. The should group are people over the age of 65, people who live in congregate care settings like long-term care facilities, and people with underlying medical conditions that put them at greater risk for severe infection. Those people should really go out and get a COVID vaccine when it's available. Everyone else is really in the may group. So, some people will think about this, and some people will choose to get a vaccine, others might not. It's important to talk to a healthcare provider if you have any questions about whether or not this is the best thing for you or your child.
All right, and we always love talking to you, Dr. Isaac Bogoch. Appreciate your weekly visit. We'll see you next week. Have a good one.
Be well. Thank you so much.